Simcoe, Muskoka. I last reported 2 weeks ago to the media, and so I have some data that would span that interval of time. At points, I'll be speaking to what's changed over a single week, not 2 weeks. So as of today, we have 11,101 cases, which is up from 947 cases 2 weeks ago. This is a 21% reduction in the case count over the week compared with last week. So a total of 439 cases during the week of May 2nd to the 8th, compared with 558 cases the week before. The province has also been coming down, and their rate of reduction is slightly less than ours at 18% reduction over the same period of time. Muskoka has dropped to a greater degree than Simcoe, a 37% reduction as opposed to 21% reduction for Simcoe County. So if we look over the last few weeks, we find a week-on-week reduction dating back to the week of the 11th of April. So every week since the 11th of April, when we had 715 cases in that week, we've had a week-on-week reduction, which is very good news. And I think safe to say that that would be the peak for us that particular week. Our number of active cases has also come down at 927 from 1,327 2 weeks ago. And over the past week, we've had 11 deaths. So I would like to express my condolences to the family members for the loss of your loved ones. So our present total number of deaths is 233. And the month of April was the third highest number of COVID deaths that we've had since the beginning of the pandemic. So over the past week, the following individuals have passed away. A man between the ages of 65 and 79 from Simcoe County, a man between the ages of 45 and 64 from Simcoe County, a man between the ages of 45 and 64 from Simcoe County, a man between the ages of 45 and 64 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a woman 80 or more years of age from Simcoe County, and a woman between the ages of 45 and 64 from Simcoe County. None of these individuals had been immunized for COVID-19. We currently have 31 people in hospital, down from 52 cases when I last reported 2 weeks ago. And 11 of these are in the intensive care unit, down from 13 2 weeks ago. The age ranges are as follows for those in hospital. 7 out of the 31 are under the age of 60. So 3 of them are in their 40s. And one of those 3 is in the intensive care unit. 4 are in their 50s, and 1 is in the intensive care unit out of those 4. 14 are in their 60s, and 7 of those 14 are in the intensive care unit. And 10 are 70 or more years of age, and 2 of those are in the intensive care unit. We've had 40 new cases reported in the last 24 hours. 38 of them are sporadic cases. 2 are workplace-related outbreak cases. 19 males, 21 females. About 50% are under the age of 35. 36 of those cases are in Simcoe County, and 4 of them are in Muskoka. 8 of them are community acquired, 13 are close contacts of the case, 2 are from workplace outbreaks, 2 of them are travel related, and 15 of them are under investigation. 38 of them are self-isolating at home, 1 has recovered, and 1 at this point we don't know. The vast majority of our active cases are in South Simcoe, as has always been the case throughout the pandemic, residing in Barrie, Bradford, West Gwillimbury, New Tecumseth, and Innisfil. The incidence per 100,000 population per week is highest in those municipalities and the very highest in Bradford, West Gwillimbury, but has reduced in all of those municipalities. So for Bradford, West Gwillimbury, for the week of May 2nd, it's down to 192 cases per 100,000 population, whereas during the week of April the 11th, it had been 334 cases per 100,000 population per week. In Barrie, it's down to, for the week of May 2nd, 82 cases per 100,000 population per week. During the week of April the 11th, it had been 136 cases per 100,000 population per week. New Tecumseth also having reduced, it had been 220 cases per 100,000 population for the week of April the 11th, but for the week of May 2nd was down to 170 cases per 100,000 population per week. And in Innisfil, a reduction as well. During the week of April the 11th had been 192 cases per 100,000 population over the week, and during the week of May the 2nd was down to 126 cases per 100,000 population per week. So trending down in all of our municipalities, and certainly for Simcoe, Muskoka overall, and for the province overall. So our weekly incidence of cases for Simcoe, Muskoka as a whole is 73 cases per 100,000 population per week, as opposed to the week before, April the 25th, at 92 cases per 100,000 population per week. And the province's rate this week is 140 cases per 100,000 population per week. So basically, we're riding at about half of the provincial rate, which is where we've been for the great majority of the pandemic. Younger people have had a higher incidence of cases, which has been pretty well the case throughout the pandemic as well. So those that are between the ages of 18 and 34 have the highest incidence of cases in Simcoe, Muskoka at 272 cases per 100,000 population over the week. And those and children and teens, those between 0 and 17, 192 cases per 100,000 population per week. And so for all of our age groups, from April into May, have had between a 52 to a 66% reduction in the incidence of cases. We remain, of course, very high overall, with a variance of concern making up the great majority of our COVID cases. So for the week of May the 2nd, 92% of our COVID cases were variants of concern. And the great majority of those variants were the B117 variant, but we are seeing an increase in other variants of concern. So the P1 variant, we now have had a total of 76 cases of P1 variant, which is up from 22 cases when I last reported. And the B1351 variant is up to 17, and it had been 5 when I last reported. There is also what has been called a variant of interest that the World Health Organization just declared as a variant of concern, the B1617 variant, originally identified in India. We had been given verbal communication from the province, Public Health Ontario, that we have had a case, and that case has not resulted in any other contacts or any other cases. No transmission has occurred from that case. If we look at our outbreaks, we've had quite a reduction in the number of outbreaks since I last reported 2 weeks ago. So we presently have 12 outbreaks, down from 27 2 weeks ago. 7 of the 12 outbreaks are with variants of concern. So we have 2 institutional outbreaks, unchanged from when I last reported. We have 2 congregate setting outbreaks with some reduction. We had 5 outbreaks in congregate settings when I last reported 2 weeks ago. So we do have 2 new outbreaks in that grouping. 1 a shelter in Simcoe County, 1 a group home in Simcoe County. And we have 7 outbreaks in workplaces, which is down from 13. So 4 new ones in a food and beverage establishment in Simcoe County, a repair and maintenance facility in Simcoe County, a accommodation location in Muskoka, an agricultural setting in Simcoe County. We have had a number of outbreaks declared over in workplaces, 15 since I reported 2 weeks ago. So 1, a transportation and warehouse facility in Simcoe County, an agricultural setting in Simcoe County, construction location in Muskoka, a waste management facility in Muskoka, a retail trade facility in Simcoe County, and 2 repair and maintenance locations in Simcoe County. We have no outbreaks in community settings, so 2 were declared over. 1, a religious organization in Simcoe County, and 1, a real estate rental and lease location in Simcoe County. And we have 1 remaining educational setting outbreaks, being a new child care center in Simcoe County. In terms of immunization, we continue to make very strong progress. To date, we've administered a total of 242,500 vaccinations. And this includes the vaccinations that have been provided in primary care teams who've administered 10,300 doses of AstraZeneca vaccine, and our local pharmacies that have administered 23,300 doses of AstraZeneca vaccine. So 36% of the residents of Simcoe County have received their first dose of vaccine, with over 21,000 individuals having received their second dose of COVID vaccination. And so we have very high immunization coverage for age groups down to the age of 70 plus. Those 80 and above, 87.6% have received their first dose. If you go down to those that are 70 to 74, 82.5% of the population in that age group have received their first dose of immunization. And then it gradually works down from there. But even for those that are 60 to 64 years of age, we have 70% of that age grouping have received their first dose of immunization. So we are making strong progress in protecting the older population, and certainly look forward to protecting younger populations. And there's a great acceleration through this month of the eligibility groups towards the end of May. And I'll be speaking about that in a little more detail later in this press conference. So we do have information up on our website with regards to the coverage overall and by age groupings for our municipality. So that information is there for the public to see and the media to see. And we have done outreach to those municipalities that have had lower coverage for older people 80 and above, and are making progress in increasing coverage in those populations as well. Working with those municipalities to promote immunization and to set up additional opportunities to provide immunization or enhance transportation to get them to immunization locations. If we look at our dashboard, the dashboard that we created for ourselves before the province had its framework, at this point, we've changed to yellow status. So we've been red status for many weeks, and we've improved now in all of our quadrants. So with regards to virus spread and containment, we're yellow due to an improvement in the 7-day moving average of cases and the number of outbreaks, a reduction number of hospitalizations, and our reproduction number is now 0.8. So anything less than 1 means that a reduction in the pandemic, that the pandemic is shrinking in our territory. In terms of laboratory testing, our percent positivity has declined to 5.2 from 6.4. When I last reported 2 weeks ago, and the 1-day turnaround time for testing is also within the target of 60% testing turnaround within that time. The healthcare capacity is yellow, improved from red. We have a green status for acute bed occupancy, with the goal being less than 90%. Also, we note that ICU bed capacity is yellow status at 86.7%, and number of beds that are being used for ventilation is at red status at 85.2%. Public health system capacity is yellow, down from red, and this is because we've made improvements in our response time. We now are meeting our objective of more than 90% of our cases being reached within a 24-hour period. So 93.2% as opposed to 77.5% 2 weeks ago. So the area that we need to improve on now is following up well with the contacts of the cases, which we are moving into at this time, returning to doing that well. Okay. I had indicated that I was going to be reporting on bed occupancy in hospitals here in Simcoe, Muskoka. I don't have that information at my disposal today, but we will get that out to you in follow-up to this meeting and work towards having that kind of information available at every single one of my meetings and hopefully up on our website in the future. I apologize that I don't have that available right now, but we will follow up with that. Okay, would like to acknowledge that this is National Nursing Week, and congratulations and commendations to nurses commemorating this week, commemorating your work. Certainly, we as a health unit have been always very dependent on nurses as a profession. And during the pandemic, we've greatly increased the number of nurses that work for us. So we have brought on over 100 additional nurses over the course of the pandemic, and now have 228 nurses working for us. And they provide a wide range of functions addressing the full range of our program delivery needs, including very much during the pandemic in response to cases and contacts, so case and contact management, outbreak response, infection prevention and control, support for and participation in our immunization campaign, and continuation of the many other things that we have always done that we've certainly had to keep up during the pandemic. So visiting vulnerable families with the Healthy Babies, Healthy Children program, either in person or virtually, supporting parents with early post-delivery calls for newborn babies and support for breastfeeding and breastfeeding clinics, working in our sexual health clinics, supporting schools throughout the pandemic, and more broadly with our school health program, Healthy Schools program, and working closely with the school boards with regards to COVID messaging, working to address substance use, so opioids and the response to the opioid tragedy, and continuing with response to the needs of individuals with regards to tobacco control and response to the use of tobacco. I would just indicate that we're also, nurses have been very active with regards to work with vulnerable populations and engaging stakeholders and mitigating the impacts of the pandemic on these populations. So we're certainly honored to have excellent nurses as health professionals working for us. And I would like to indicate that certainly they are answering the call, just to cite the theme for this year's National Nursing Week in Canada. With regards to COVID immunization, this has been a very busy week with regards to additional eligibility groups. So those individuals who have what we call at-risk health conditions would be eligible to receive immunization, to book for immunization. One of the things I really need to note is we are getting more vaccine, and certainly that will help us to respond to the additional eligibility groups. But as they become eligible, there may be some delay before they're able to actually attend their booking. They'd be eligible to get a booking, but there can be some delay before they actually are able to get an immunization. The date of their booking can be a little delayed. So I just feel that that's important for people to know. But anyway, those that are eligible include those with at-risk health conditions, and also what we call the second group of essential workers. These are individuals who cannot work from home. If you go to our website, you'll find a detailed listing of exactly which individuals with health conditions would be qualified, and which individuals who are working, what type of working professions and groups would be included in that category. These individuals would be able to book online or by telephone with the provincial booking system. So have a look at our website and you can find out more details about how to do this. Beginning on this Thursday, May the 11th, all those who are 40 or more years of age would be eligible to book in the provincial booking system to receive immunization. And there are now additional groups that would be able to receive their second dose earlier than the 4-month interval that is the case for the great majority of people. So they'd be able to get it within the specified time frame for the vaccine that they've received. So 21 to 28 days for Pfizer, Moderna. So these individuals include people who are on dialysis, and those who are on dialysis would get their vaccine through their hospital program. So just as they receive their first dose, they would receive their second dose in the same way. We're also reaching out to members of the Indigenous community who would qualify to receive their second dose, working through partners in the Indigenous community to be able to do this. And also, in the very near future, those who are considered to be highest priority healthcare workers would be able to book to receive immunization. And actually, we await, I should correct myself, we await clarity from the province as to the approach to be taken to book these individuals, and also the date in which this could commence. So this is supposed to be announced by the end of the week, and we await for more information from the province on that. Just as I'd indicated, it's important for all those who are seeking to book, who are qualified to book now or in the near future, that there can be some delay before they actually would be able to receive their immunization. We do keep a standby list for vaccination for our clinics, because there can be vacancies at the end of the day. The list that we keep is always people who fall into groups that are actually eligible to receive vaccination. And it works by individuals contacting us in order to inform us that they want to be on that list. And the list is kept each day, and then it has to be renewed the following day. So we have now changed this so that the opening time for individuals to call us or contact us, to email us, to get on this booking is now 8 o'clock in the morning. It had been 7 in the morning, but now it's 8 o'clock in the morning. So certainly invite people to have a look at our website about that. The province is proceeding with providing Pfizer vaccine or Moderna vaccine to some pharmacies. And we expect that there'll be some pharmacies at some point through this week in Simcoe, Muskoka, that would be launched for that. We await more information about that. And the province does keep a listing on the internet of those pharmacies. We also are one of 15 health units that are participating in a pilot for primary care offices, family physician offices, to be providing Moderna vaccination. It's a very limited quantity of vaccine, but it will continue week on week. And we ask that people not contact their family medical practice office about this, that instead we leave it to those practitioners who receive vaccine to reach out to their patients in order to make this arrangement. We participated in an education and enforcement initiative on the weekend of April the 30th to May 1st with the Ministry of Labour, Training and Skills Development, and with other provincial ministries, as well as with police and municipal bylaw officers. And a total of 173 businesses were visited in this engagement process. There was a high degree of compliance, more than 70% overall noted. Only 4 provincial offense notices were issued. We do keep information about 3 tickets related to this from the health unit on our website under our enforcement page. So the most common offenses were related to lapses with regards to having a safety plan, screening requirements, or adhering to capacity limits. And also we noted vulnerability with regards to staff lunchrooms and the need for caution and how they're operated to avoid exposures among staff. And so I would invite businesses, as always, to have a look at the materials that we have on our website to inform them about how to operate safely and in compliance with legislation, as well as with my letter of instruction. So the following question from the media: how is it possible for people from outside of Simcoe, Muskoka to book vaccination appointments in our clinics during the stay-at-home order? How many people from outside of our region have been coming here to be vaccinated? I would say that it is true that with the stay-at-home order, travel should be limited to essential purposes only. seeking health care would be one of those purposes. I think it's much preferable for people to be getting both close to home. I have indicated in the past that it is a priority for people to get immunized, and that I think people formerly had certainly the right to travel for that purpose. I think, though, that given we do have a stay-at-home order, it would be much preferable for people to find the means to do so close to home. I do note that the provincial booking system actually allows, though, for people to book elsewhere, not close to their home. And for that reason, people have been able to book to come here and be immunized. We did have a look at the balance of things. How much vaccine are we providing to our to other people outside of Simcoe Muskoka here in Simcoe Muskoka versus how much vaccination is being provided to our Simcoe Muskoka citizens who travel out of our area to get vaccination elsewhere. And we found that we have a slightly positive balance for ourselves, that slightly more citizens from Simcoe Muskoka get vaccinated out of Simcoe Muskoka than the amount of vaccination that we're providing within Simcoe Muskoka to people who are from elsewhere. So that is something we're going to keep a very close eye on, given the potential for people who have secondary residence or traveling here otherwise to be seeking immunization. We want to make sure that we're able, one way or the other, to provide immunization to our citizens. So at this point, I'd be happy to take questions.
Thank you so much, Dr. Gardner. As you mentioned, we will now take some questions from the media. As always, kindly limit yourself to one question and one follow-up so we can ensure that everyone has the opportunity to participate. And just a reminder to please unmute and mute yourself. Can we start with Chris Simon today from the Barrie Advance?
Sure you can. Thank you very much, Dr. Gardner. I'd like to talk about the reopening of schools, if I can. There have been calls from some medical associations to look at that, even trying to get kids in for the last month of school. Where do you stand on that, based on where we've been trending over the last couple of weeks in Simcoe Muskoka?
Well, it's always been a priority to have our children in schools to the greatest of our ability to do so safely. And I've always noted that there's actually a very limited amount of transmission that happens in schools. There's a lot more, when we have a lot of transmission happening in the community, there's a lot of exposure that happens in schools, but the great majority of time that doesn't result in transmission. When we've had very high rates of transmission, it becomes very difficult for us to properly follow up promptly and thoroughly with school exposures. And so we become very concerned about our ability to make sure that it's safe. And so when the province chose to close schools and go with remote learning, that was, I think, a safe thing for them to be doing. But we know that there's a negative impact on child well-being by not being able to attend school, on their mental and physical health, on their educational attainment, and also with regards to family well-being and the ability of people to be able to go to essential work. So I would be supporting it to be happening, at some point in the relatively near future. We still, although we've had quite a significant reduction in transmission, we still have a fairly high level of transmission. So I don't know if we're quite prepared yet to be able to ensure that schools are safe, but we are very much moving in the right direction. And I do believe that it would be preferable to be able to get children back into classes at some time in the near future before we lose the ability to do so with the summer vacation.
Okay, and my second question, there's been lots of talk too that the province is going to extend the stay-at-home order into early June. Do you see it going beyond that, and is that the right call?
I certainly agree that it's the right call. As you know, I was very concerned in February when we did, and we have at this point much higher rates of transmission than we did at that point when we opened. We were having about 1,000 cases a day in the province at that point, and we're over 2,000 now. And to me, I agree with the chief MOH when he said that we need to be significantly lower than we were back in February before we opened. I think the real risk of opening too soon is that you could end up with a fourth wave extending into and through the summer. So we certainly do not want that. I would say that there's a real possibility that you'll need to do some extension even beyond June the 2nd. But even if we don't, the first steps to opening up need to be very, very cautious. And personally, I believe that we need a broader approach across much bigger areas than just single health units with regards to the restrictions, possibly the province as a whole. That is what worked with wave one, that kind of a stepwise approach for the province as a whole.
Sorry, just a point of clarity, would there be a benchmark that you would be looking for then before we could look at maybe starting to open things up again?
That is not completely clear to me at this time. I know of the discussions that are happening at the province about that. I don't have a clear benchmark in my mind at this point, but I do believe that it was too high and too soon in February when we were at 1,000 cases per day in the province.
Thank you very much.
You're welcome.
Erica Engel from Collingwood Today.
Hi, thank you very much. Dr. Gardner, I was wondering if you've seen an impact on case data since the vaccines have rolled out in a more significant manner. For example, it looks like fewer people in the higher age categories.
I would say that the great change is a profound reduction in outbreaks and deaths in long-term care facilities and retirement homes. We've continued to see cases and deaths in seniors, but even that I note when I spoke of those who had passed away today were not, generally speaking, the 80 plus group that it had been all the way along. So the pattern of mortality has changed and is continuing to change quite dramatically. We're seeing a protection of those that are vaccinated. And we started with those that were most vulnerable, those that were 80 plus. And because they've had vaccination ahead of everybody else, we're seeing the protection occurring in that group, the reduction in mortality in that group. And we continue to see the highest incidence of cases by far among the younger population, young adults and youth and children. Those groups have not, for the most part, had the opportunity to be vaccinated yet.
And so what does that mean? What does that say about the vaccine then? I mean, in December when this all started, there was still a lot of unknowns about the impact of the vaccine transmission and how quickly it would work. How do you see that now? Are you encouraged by the results?
I'm tremendously encouraged by the results that we've seen for immunization in this province. Public Health Ontario put out a report just a few days ago that looked at transmission among the vaccinated in this province and noted that 0.06% of those vaccinated had contracted COVID-19. So that's a very low transmission rate among the vaccinated, and 2/3 of those were among people who really hadn't had enough time for the vaccine to work within the first 2 weeks of their first dose. So the vaccines are very highly effective. And there's mounting evidence that they also reduce transmission to others, that the asymptomatic transmission is also greatly reduced with vaccines. So they are proving to be highly effective. And thus, I certainly advise everybody when they have the opportunity, when they become eligible, to seek out and get vaccinated.
Thank you very much.
You're welcome.
Mary Beth Hartle from Muskoka Region.
Hello. Muskoka Shores, 2 new staffers. Do we know if they've been immunized? I know the other ones had. So just wondering if the 2 new cases at Muskoka Shores have been vaccinated.
I would need to look at that and get back to you. I do need to be careful about how much information I give about individuals, but I will look into that.
Okay, thank you. And nothing else other than I hope you're doing well.
Thank you very much. You too.
Don Huddlestone from the Huntsville Doppler. Do you have a question today? Okay. Mike Arcelides from CTV Barrie. Do you have a question today for Dr. Gardner?
Yes, doctor, welcome back.
Thank you.
What's the most encouraging thing you're seeing right now from folks?
One would be the impact of immunization. Also, the uptake of immunization. We've just had such a profound uptake among older people. Those who need it the most have been accepting it. And we're seeing the results of that. But the other would be with this shutdown that we are seeing a reduction in transmission, that the worst case scenario for the ICU capacity in the province being overwhelmed appears to have been avoided. So thank goodness we've seen that kind of an outcome. So those are certainly 2 positive outcomes that I would cite today.
What's concerning right now from what you're hearing? How are folks getting infected sporadically? Is it gathering still? Are people just saying, we're going to have barbecues, we're going to have these guys over, we've had the vaccine, we're safe?
Well, for one, I was always worried about workplaces, and we continue to have some new workplaces that have outbreaks. But you've seen from the data that that's greatly reduced. And so that speaks once again to the impact of shutdowns. I know that the closure of many workplaces and businesses is certainly a hardship for many, many people, but it has helped to result in a great reduction in outbreaks in work environments. We continue to have an ongoing in the range of 10 household clusters a week, and that up to half of the people of those households become infected. So that remains a vulnerability for us. We do note that there are areas of our district that are a lot more vulnerable. We have a hotspot in Bradford, West Gwillimbury. We do know that racialized neighborhoods are more vulnerable. They can have as much as 4 times the incidence of COVID-19, and that would be related to the nature of the work that they engage in, or perhaps multi-generational housing, where older people can be exposed to younger people in the household as cases. So that really speaks to how important it is for us to continue giving added attention to immunization in that community, and to continue with immunization throughout the district. So I guess I would say that what people do in their daily lives socially really matters, and people really need to take to heart the stay-at-home order and not have other people over into their homes, and not go into other people's homes, and abide by that restriction, because that's certainly a vulnerability for people. They need to continue abiding by that. And the other thing I would say is that it's really important that people take the opportunity when they can, when it comes up for them, to receive immunization. We've had a high uptake to date, but we need that to continue all the way through to the very end. We need to get a very high vaccination rate in the population as a whole if we're going to get herd immunity and actually have a lasting control of the pandemic here.
If I can ask quickly, do we have any indication if we're going to see supply increase past 25,000 a week?
We will have a further increase in immunization vaccine at the very end of May. Beyond that, I don't know. But certainly things have been headed very much in a positive direction for Pfizer vaccine, now more so for Moderna vaccine as well.
Thank you.
You're welcome.
Mo Fahim from MyFM. Do you have a question today?
Hi, it's Mo Fahim with My Muskoka Now. Yes, my question is, are there any reported cases of individuals contracting COVID-19 after getting their first dose of a vaccine in the district of Muskoka?
So at this point, I don't know. It's certainly something that I want to know. And it's something that I definitely seek out with regards to those who passed away. We've had only one individual among those that have passed away who had received immunization, and that individual actually received it just after developing some symptoms. So it was already really too late for them to benefit from the vaccine. So among those who passed away, there have been none who've been immunized, but I actually don't have a figure for you with regards to individuals contracting COVID-19 here that we know of who'd been immunized. I think it's a very good question, something I want to chase down. We do have the Public Health Ontario report for the province that indicated that of those in the province who've been immunized, only 0.06% have developed COVID-19.
And as a follow-up question, what can you tell to those who did get one dose of a COVID-19 vaccine and are kind of starting to ease off on a personal level because of the comfort that it's just one dose? What kinds of instructions? What kinds of measures? I know they should stick it to all the measures, but what are the big things that they would think they shouldn't do, but they really should still be doing?
I think it's important for them, while they might take comfort in that protection, and there is a high degree of protection with a single dose, it's not as high as it will be with 2 doses. And at this point in time, we're really not recommending any kind of relaxation of control measures for anyone, even if you're fully immunized. That may change with recommendations to come, and there are recommendations in the United States about fully immunized people and what they can do that's different. But so far here, people need to continue with the full protective measures, whether or not they're partially or fully immunized or not immunized at all. And what I see, as probably the 2 areas of great vulnerability are household gatherings beyond your household, getting together with people outside of your household, and in particular indoors. So in your home or in their home, you need to be very careful about that. You should not, in fact, engage in that. The only exception being people who live alone would adopt one other household to have that kind of contact with. And the other would be the work environment, that people need to continue to abide by all the infection prevention and control measures that are in place in the work environment, and that employers really need to set things up and enforce that.
James Bowler from Cogeco, do you have a question today? Okay. Mark Claremont from Muskoka Today, do you have a question for Dr. Gardner?
Yes, thank you very much. Doctor, could you expand a little bit more on, according to your website, there's a accommodation outbreak in Muskoka of 10 cases. Could you just tell me where that was or is? And excuse me, if it took place on April 29th, does it automatically come off after 14 days? Or if somebody within those 14 days further gets more COVID or contact with the outbreak end?
So I'm afraid that I can't tell you where this is. We don't divulge that kind of information. The only time we would is if it is a public institution, like one of the schools or long-term care facilities, retirement homes, or a hospital. So I'm afraid I wouldn't be able to give you more information about the name and the location and such. With regards to your second question, outbreaks continue until 14 days after the last exposure or onset of the last case. So while you're continuing to get cases happening, the outbreak persists.
Oh, and regarding those 10 cases, can you just confirm that it is one location, though?
I can indicate that it is a accommodation location.
Just one, yeah. My other question was, I was on a Zoom call this morning, and somebody told me that that was a man. He said that his wife received the vaccine through the pharmacy, through a pharmacy. And because she has cancer and she was going in for radiation, she wanted to get, they advised her to get it at least 2 days before she has her chemotherapy. So they tried to book it through the provincial website and was turned down because they said they're already in the pharmacy stream. Does that sound fair or correct even? Correct, firstly?
So, I'd have to indicate that because I don't know the details of the situation, my information is going to be, of course, limited to what you just told me. I would say that individuals that have high-risk medical conditions like that would be priority to receive vaccination. Certainly, I would defer to the advice of the attending clinician about the exact timing that would be preferable given their clinical situation. I would say that the pharmacies have their own booking system, so they're not participating in the provincial booking system. If this individual was seeking immunization at a pharmacy, they would have to book through the pharmacy. Same with primary care providers that are providing vaccination.
Is there an appeal process where a person could appeal to some higher authority to ask for this special consideration, or a physician perhaps would do that? It's hard for me to comment because I only know what you've told me about the situation, but there is no appeal process that's been established with regards to the vaccination program. Okay, thank you very much anyway.
You're welcome.
Can we go over to the phone line? Are there any questions from the phone today?
Hi there, Doctor. It's Ian from Barrie 360.
Hello.
And I'm just wondering, on the weekend after this, we're heading into the May long weekend. And a year ago, Barrie, Innisfil, Wasaga Beach, there was concern about people coming, heading north. Sort of protocols were put in place almost to keep everybody out except, if they were a resident to a beach or a waterfront park. And I'm just wondering if you could message the people in the GTA or those that have seasonal properties and with a possibility of an extension of stay at home, what's the message to those people who would like to come up and access their properties?
I would advise that they abide by the stay-at-home order, that therefore they would determine what their home is, and they would therefore stay at their home. If they are deciding that their secondary residence is their home, that they would make it such, pick a location and determine that is your residence and stick with it, rather than moving between more than one accommodation. We need to limit population movement to continue to have success with the third wave to continue to have it come down. We know that there's a correlation between population movement and transmission. So, I think all of that would be, key as far as my message for people. And I would also indicate that at this time, while the shutdown and the stay-at-home order are in place, that people are allowed to move through beach areas, but not linger on or stay at a beach. So that's a restriction that's in place with provincial legislation. Of course, if that doesn't get extended through the May 24th weekend and into June, and we do anticipate that they're going to do that extension. But if it doesn't, then that would be lifted. But we may very well find that municipalities start to look at what kind of restrictions they would want to be putting in place to help support and reinforce this approach to staying at home.
And finally, Doctor, it's almost been 2 months now, or a month of protests in downtown Barrie or other locations. And now with numbers going down, as indicated provincially and locally, I'm just wondering if that gives any ammunition to those that are protesting that, you see, we can gather and there isn't a problem. And that's some of the mentality out there among the crowd that does protest. And I'm wondering how you might respond to that.
I would say that people really need to abide by the stay-at-home order, and that there is a prohibition on public gatherings at this time, but people need to abide by that. It is following the law to do that. And so protests would be gatherings, and that there's certainly a risk for people coming into close contact with each other in large numbers like that. It is hard for us to actually detect clusters of cases related to this, because such individuals may not seek attention if they're cases, or for that matter, report that exposure. So therefore, we're not picking it up in our surveillance, but we do have a significant number of cases that are community acquired cases where we just don't know where they had acquired it. And some of that could very well be related to this kind of exposure. We've had success now in bringing down our numbers. We need to have a lot more success. We're only really starting to move in the direction we need to. We need to continue going in that direction. And these kinds of gatherings would be working contrary to our success.
Okay, thank you.
You're welcome.
Is there anyone on the line that I've missed who hasn't yet had their question answered today?
That would be me. It's Adrian with MyFM.
Hi, Adrian, go ahead.
Hi, thank you. Dr. Gardner, I'm just wondering about the mixing and matching of vaccines. I know that the different types of vaccines are actually different. They're manufactured differently. And now it's being suggested that some people who received one type of vaccine for the first one might be getting a different type for their second one. Will they work the same? Will there be some type of interacting within the body? Will it be like getting 2 first shots?
Thank you for the question. That is a subject of ongoing research at this time. In the United Kingdom in particular, they're very interested in that question. So we look forward to getting the research results to inform us. It'll be very helpful to us, I'm sure, in a lot of instances, if we could mix and match and make it less complicated for follow-up for people. There is some speculation that it could be added, there could be added benefit, perhaps a more robust immune response associated with mixing and matching a vaccine like that, but we don't know at this time. So we need to await the results of that. But, we do know that other types of vaccines, influenza vaccine, for example, people can change from one vaccine to another in different years without any issue. If necessary, that's been done with other types of vaccine as well. So we do have that experience to draw on, but we are awaiting the outcome of the research.
Are the vaccines though? But you don't you don't usually get sort of two at once, as being suggested with this particular vaccine, right? And they are manufactured differently. And so I'm just wondering, I mean, the medical community always suggests, don't mix your medications, don't take this with that, and without a doctor's recommendation. So what if a person who receives, say, the Pfizer vaccine is then offered the AstraZeneca vaccine as their second dose, and they say no? Are they not going to get a second shot, or will they be turned away?
So at this point in time, everybody needs, if clinicians, those who provide vaccination, need to follow the provincial direction, which is that you don't make a change like that. But the question of whether we might in the future is part of research that's happening now to inform whether or not in the future we can offer a change where it would help us. So to speculate about, an individual in the future being offered that and what it might mean, or what it would mean if they don't want it and they're offered it, I think it'd be premature at this time. We really need to wait for the research and follow then the direction from the National Advisory Committee on Immunizations.
Can I just quickly follow up with that then? Does that mean that everybody, say in Ontario or Canada, will be getting two of the same?
At this point in time, for those that are getting their second dose, up until now, they've been getting the same. Well, I understand from the media that there's a possibility of change in that in Quebec at this time. But up until now, everybody has been getting, for their second dose, the same type of vaccine that they had for their first dose. If research suggests that we can do otherwise, and we get support from the National Advisory Committee for Immunizations to do otherwise, and support from the Ministry of Health to do otherwise in the future, then we could find that we change our practice. But we have to wait and see about all of that.
Okay, thank you.
You're welcome.
Is there anyone else I've missed today who hasn't had the opportunity to ask their question? Okay, in that case, I know, Mo, you had one more final question for Dr. Gardner today. Please go ahead.
Yes, please. Thank you. So, Dr. Gardner, with neighboring health units like the North Bay Barrie Sound District Health Unit referring the residents to get tested in Muskoka, in the district of Muskoka, and possible out-of-district residents also getting their vaccine shot in our district, are you in any way concerned of, first of all, the spread of the virus in light of travel to get to the district, and is there any way to differentiate out-of-town numbers and daily testing and vaccination numbers?
Certainly, we can differentiate all of that, and we are actively following that from a vaccination perspective. So we have data about how much of vaccination that's provided at our clinics is providing to people out of district. And I have no doubt that I'd be able to get data about assessment center testing and where people are coming from. I would say that I still believe that with the stay-at-home order, it's preferable that people go close to home if they can to get immunized, or for that matter, to be tested. There are people that live at borders, and it may be for those individuals closer to actually come here across the border to get those services than to go elsewhere in their district. So they would actually be abiding by the spirit of stay at home better if they behave in that way. I would say at the end of the day, because we're monitoring the balance of things, and we know that so far we've not fallen short. We're getting as much vaccination as we're giving for our citizens, that we're okay if we end up falling short giving more vaccine to others rather than our citizens getting vaccine out of district, that I would be going to the province and asking for more vaccine to help make up that difference.
Okay.
Perfect. Thank you. I don't have any follow-up.
Thank you. Well, that will conclude our media briefing today. Thank you so much, Dr. Gardner, for your update, and thank you so much for everyone for your participation.
Thank you, everybody, and have a good day. Bye-bye.